teach people who are teachers or who are going to become teachers. And I use my experience from Papua New Guinea in my teaching, and actually most of my classes. And I think that what I am able to offer them with a slightly more global perspective than I could if I didn't go to Papua New Guinea, I think helps them be better teachers and opens up possibilities of things that they hadn't thought about.
So 25 years ago, 1986, started by a group of RPCVs who want to do community service project.
A year, one workday a year, we do anywhere from nowadays 60 to 100 houses. You know, a couple thousand volunteers on that one day all over the city helping the elderly and disabled keep their houses up to code. And the city likes it, and it maintains the housing stock of the city.
And the typical homeowner that we have is an elderly person, a widow or a widower. They're usually living on fixed income. They don't have family. They don't have the technical skills. Most of them are in poor health. So these are people who slip through the cracks, and they really are very needy.
And I taught refugees. Most of them were Vietnamese. A lot of the people that came in out of Desert Storm were coming through our program because they, again, were refugees. I've taught sixth grade Spanish speakers how to write. I'm now volunteering and teaching adult women who are trying to get their GED program, and all of my students are Hispanic women that are looking to do something better.
The thing is, my entire career was spent teaching schools. And in fact, I got my very first job from the principal because he said, already had another former Peace Corps volunteer on staff, and he said, if you're half as good, I knew I wanted you. But it gave me such an understanding of people.
From a public health standpoint, you really want to be able to engage the population, sort of know where they're coming from, why they have the problems they have. Latinos are amongst the highest level of diabetes, and diabetes and obesity is a huge problem in the United States now. And so knowing sort of where they came from, who you're dealing with, who is your client or who is your population, and is very, very important.
My Peace Corps experience had me wanting to do more to help society. I offered a job at MD Anderson. I offered a job at Ben Taub. Ben Taub is our charity hospital. I chose Ben Taub because I felt like I had the more impact or could help people more, because the people there have no insurance, had no benefits.
And again, it's really just using a lot of the tools, a lot of the intangibles I learned from Peace Corps about rolling with the punches, finding ways to make things work when you didn't have all the tools you needed. And I've taken that to contribute now to the food bank, which is a great organization that really leads in the fight against poverty here in the 8-county area of Southeast Texas.